Hello and welcome to the Prostate Health Channel, your trusted source for information, awareness, and prevention strategies for men's health, especially when it comes to the prostate. If you're new here, it's great to have you with us. And if you're returning, welcome back. In today's video, we're diving deep into a crucial topic that's transforming how we diagnose prostate cancer: the use of MRI scans. This imaging technology has revolutionized prostate cancer detection, helping doctors make more accurate diagnoses while reducing unnecessary procedures. Prostate cancer continues to be a major public health concern. In many Western countries, including Australia, it's one of the most commonly diagnosed cancers in men, right behind skin cancer. Every year, tens of thousands of men receive a new diagnosis, and thousands more lose their lives to this disease. But with advances in diagnostic tools like MRI, we are now in a better position than ever to detect prostate cancer early and intervene before it becomes life-threatening. Let's begin with how things used to work. For decades, the standard screening process began with a PSA blood test. If the test showed elevated PSA levels, men were usually sent for a biopsy. But here's the issue. These biopsies were often done without imaging guidance. They were what we call random or non-targeted biopsies, typically performed through the rectum, and they had several limitations. The biggest problem with random biopsies was accuracy. Since there was no clear visual target, some cancers could be missed, while in other cases the procedure could pick up insignificant abnormalities that didn't require treatment, leading to unnecessary stress and procedures. This is where MRI comes in, a game-changer in prostate cancer diagnostics. MRI, or magnetic resonance imaging, is very different from traditional imaging tools like X-rays or CT scans. It doesn't use radiation. Instead, it uses powerful magnets to create detailed images of the inside of your body. To put it simply, it uses magnetic fields to make water molecules in your body vibrate, and a computer converts those vibrations into high-resolution images. These detailed scans allow medical professionals to see the prostate in much greater detail than ever before. And not just the shape and size, MRI also gives us insight into the internal structure of the prostate, including tissue density, blood flow, and other indicators that help predict whether cancer might be present. Now let's talk about what changed over the last 10 to 15 years. Although MRI technology has been around for a long time, recent upgrades in magnet strength and software processing have dramatically improved image quality. For prostate imaging, most centers now use a 3 Tesla MRI scanner. That's twice the strength of the older 1.5 Tesla machines, offering a much sharper, clearer picture. With this high-resolution imaging, specialists can now identify suspicious areas more reliably. And this is where something called the PI-RAD score comes into play. PI-RAD stands for Prostate Imaging Reporting and Data System, and it's used to interpret and categorize the likelihood of cancer in an MRI scan. It works on a scale from 1 to 5, with 1 being very low likelihood and 5 being very high. Let's break that down. PI-RADS 1 or 2 means the prostate looks normal or may show benign changes such as inflammation. PI-RADS 3 is the gray area, not clearly normal or clearly suspicious. PI-RADS 4 indicates a high chance of clinically significant cancer, and PI-RADS 5 suggests a very high probability of aggressive cancer. Statistically speaking, men with a PI-RADS 4 lesion have about a 75% chance of having prostate cancer. For PI-RADS 5, that number jumps to around 95%. The difference between a 4 and a 5 often comes down to the size of the lesion, not necessarily its characteristics. So, what happens next if a suspicious lesion is found? For PI-RADS 4 or 5, a targeted biopsy is usually recommended. This is not your traditional biopsy. It's a much more precise procedure. Instead of taking random samples, doctors use the MRI images to directly target the area of concern. This can be done using cognitive fusion, where they mentally map the MRI to the ultrasound, or with software that fuses MRI and real-time ultrasound imaging for even greater accuracy. For PI-RADS 3 lesions, the path forward is a little more complex. About 30% of these lesions are found to be significant cancers, while the rest are benign. In these cases, the decision to biopsy depends on several factors, including your age, family history, other health conditions, and personal preferences. Some men might choose to proceed with a biopsy, others might opt for a PSMA PET scan, another advanced imaging tool, or simply monitor their PSA levels over time to see if the situation evolves. It's important to note that no test is 100% perfect. Even with today's powerful MRI scanners, there's still about a 10% false negative rate, meaning that 1 in 10 scans may miss a cancer that is actually present. That's why follow-up is essential, especially if PSA levels continue to rise despite a normal MRI. In such cases, a PSMA PET scan or repeat imaging may help detect hidden or early-stage cancer that was not picked up the first time. Now, there are some cases where an MRI scan isn't possible or may be less reliable. For example, men with pacemakers or certain implants may only be able to use lower-strength MRI scanners like the 1.5 Tesla, which can reduce image clarity. Hip replacements or prostate implants like UroLift can also create artifacts that interfere with image quality. That said, for many men, MRI is not just a diagnostic tool, it's part of long-term active surveillance. This approach is often recommended for men with low-grade prostate cancer, such as Gleason 3+3, grade group 1. These cancers are slow-growing and unlikely to spread, so immediate treatment might not be necessary. Instead, men are closely monitored with regular PSA tests and MRI scans. In most practices, an MRI is performed every year, and a confirmatory biopsy may be done within the first year to ensure that no more aggressive cancer was missed. If everything remains stable, this approach allows men to avoid surgery or radiation while keeping a close eye on their condition. Even in older men with low-volume Gleason 3+4, grade group 2 cancers, some specialists may consider continued monitoring with MRI, depending on the overall health and risk profile of the patient. So, to summarize, MRI scans are a powerful and non-invasive way to assess prostate health. They help reduce unnecessary biopsies and improve accuracy in detecting significant cancer. MRI-based diagnosis combined with the PI-RAD scoring system allows for personalized, risk-based decision-making. And while MRI isn't perfect, it's currently one of the best tools we have for detecting and monitoring prostate cancer. If you've made it this far in the video, thank you. We hope this information helped you understand the modern approach to prostate cancer diagnosis and why MRI plays such a vital role. If you found value in this video, please give it a thumbs up, share it with someone who might benefit, and subscribe to the channel so you don't miss future videos. Also, don't forget to click the notification bell. We're constantly uploading new content to support you in taking control of your prostate health. Thanks again for watching, and remember, early detection saves lives. Take care, and we'll see you in the next video.